Everybody talks about how tough PGY1 is, but for some reason, nobody talks about how tough PGY2 is. The problem with PGY2 is that overnight, you go from writing notes and putting in orders to becoming the person who's leading the team and setting the pace for the team. You are now expected to teach. You are now expected to be responsible and accountable. The things that you thought didn't matter now matter even more. For example, your ITE. And most of us do not get adequate preparation for this. In this video, I'm going to be going through the problems that most of the PGY2s think about and how we can overcome those problems. And additionally, we'll talk about the strategies that you can put in place that will help you stand out in PGY2. Let's get to it. So number one, you have to rebuild your confidence. You see, the thing is, in PGY1, we were nervous, we had so many knowledge deficits, and that can hurt your confidence. So throughout your PGY1, as you learn, you build your confidence. But by the end of PGY1, you may not have built your confidence to the point where you feel confident enough to lead yourself and your team. So that may be the contributing factor to why you feel not ready. And how you can overcome this is to build a system, like a checklist in your head. Know your patients and approach them with 3 checklists. Number 1, what's the overall picture? Number 2, what's the trajectory of this patient? And number 3, what does this patient need today? When you speak with your team, you have a plan for today, you have a vision for tomorrow. Having a plan and having knowledge about where your patients are coming from and where they are going to can change the way you feel about yourself and the way you feel about your team. If you have this in your head for every single patient, you can easily simplify a list of 20 patients. That's one very simple approach to look at it. Now, obviously, I don't need to tell you that you need to know your patients, chart review, and be on time. This is what you already know. Number 2, teaching is now your job. Now, most of us were not taught how to teach. I get it. But as a PGY2, you are responsible for your intern. You're responsible for the medical students. So it is now the time for you to get comfortable with teaching. Your interns, your medical students do not expect you to be perfect. What they expect you is to care enough to want to teach them. So keep it simple. No need for a PowerPoint presentation. Pick a patient, briefly go through the patient, and then the next day, talk to your interns and medical students very casually about what you learned yesterday. What I do, I'll just say, let's use 5 minutes to go through the EKG today. Another example is to pick a topic that always trips you up. So you say, oh, acid-base balance always confuses me, but now this is how I think about it. And then you teach your intern, you teach your medical students. Because the chances are, if you have a problem in that topic, your interns probably will also have problems. Number 3, your efficiency. In PGY2, your efficiency also depends on the efficiency of your intern. What you want to do is try and teach them how to be efficient as soon as possible. You want to get them dot phrases, you want to get them favorites, you want to get them shortcuts. Everything that your intern needs to be efficient, you want to provide them and keep reminding them. That will make your life easy and it will make their lives easier. So you guys can now focus on patient care, focus on teaching, focus on learning. One of the best things that you could do is to have your interns know what their expectations are. So before you start a rotation, you can send a message to the intern and then have them know that this is the expectation of what we have, this is what I like, and these are the resources that you could use. And if you have any questions, you can let me know. So you want to set them up to succeed. Another mind shift you need is your energy. The way you walk into the hospital, the way you speak with the nurses, the way you speak with your interns, the way you communicate with your attendants, that sets the tone for your team. Remember that today might be just any other day for you, but it's a very important day for your intern, it's a very important day for the nurses, so you have to bring that energy. The way I think about it is that when I come into the hospital, I always want to be very positive, personable, very relatable. I want to be able to see my patients, to connect with my patients, to connect with the interns, connect with the nurses. It makes the camaraderie so real and it makes teamwork so easy. Another strategy or mind shift that you need in PGY2 is a study plan. Now, for those of you who don't know, the interning exam is very important in PGY2. It's by far one of the most important things that they look at in PGY2. Now, I know we've heard that interning exam is okay, you can do okay, you don't have to do so well on it. But this changes in PGY2. In PGY2, you have to crush your ITE. And how do you do this? I approach it in 2 ways. I have the clinical approach and I have the test-based question approach. And the clinical approach is you come into the hospital, you see 5 patients and 5 of them have 5 different diagnoses. You pick one of those topics, for example, COPD, and you do a very brief read about COPD, very brief. And I usually just read about it, maybe 3 things, the pathophysiology and treatment. That's all I read, just very briefly. In terms of test-based, I did 1 to 3 questions every day. If I get to the point when I've seen so many COPDs, now I can do a much more deeper study study, but the first time I just read mostly about the pathophysiology and management. That's all I study. You want to keep it very simple and lower the barrier to entry. You don't want to make a big plan that you don't start to begin with. Keep it very simple. And then I augment with reading questions every single day. And then finally, one of the strategies or mind shifts that we need to have in PGY2 is understanding that at this point, your identity as a doctor is being formed. It's being crystallized. Ask yourself a question and say, what kind of doctor do I want to become? What kind of doctor do I want to be known as? What I think about it is, if my colleagues needed a doctor, would they think about me as being someone fit to be a physician for them? And what you can do is work actively on your feedback, take on leadership roles, become very curious, see your patients, deliver fantastic care to your patients. You want to remember to be kind, to be compassionate, all the things that you already are, but you just want to be intentional about them. I believe that every single one of you is ready and have what it takes. Remember, PGY2 is not about perfection. It's about purpose, consistency, and leadership. If you have any questions about PGY2, you could drop your questions in the comment section. And as usual, see you in the next one.